Hello, my name is Dr. Adam Breiner, and today we are going to discuss concussions. It's in the news. Yes, you've heard about it a lot. It's in a lot of people's minds, but there's a lot of questions that people are coming up with, like what is a concussion and what does it mean for me and my family, and what can I do about it? I have a center here in Connecticut, and I've been treating traumatic brain injuries and concussions for well over 10 years. And it's all called the NeuroEdge Brain Performance Center. It's a division of the Breiner Whole Body Health Center. We're a clinic, a holistic integrative clinic, where we have everything from dentistry to naturopathic medicine all under one roof. I'm trained as a naturopathic physician, but I've also done extensive work over the years with training with some of the world's best leaders in hyperbaric oxygen therapy, neurobiofeedback, and many, many other disciplines. So I want to share with you about concussions with this webinar presentation. So there is a lot of information, but it's really good stuff, and I'm sure you're going to learn a lot. Now, you're going to see my presentation here, and I'm calling it Concussions, New Hope and Insights into Traumatic Brain Injuries. And here are some of the things I'm going to discuss, like what a concussion is, what are the signs and symptoms, how do you diagnose a concussion, what are the standard medical treatments, and of course, what are some cutting-edge approaches, such as EEG Neurofeedback, hyperbaric oxygen therapy, phototherapy, altitude contrast training, PMF, nutraceuticals, nutrition, and more. So first off, what is a concussion? Well, it's a traumatic brain injury, and it's often referred to as a mild traumatic brain injury. All right, you've heard TBI, traumatic brain injury. And that's when there's an impact to the head or any rapid change in force and direction of the head, like an acceleration or deceleration. And this results in a disruption of normal brain function. There are different grades of concussions. Grade 1 is where people feel a little confused. They never lose consciousness. They may just have trouble following directions, and it seems to clear up in about 15 minutes or so after the hit. Then there's grade 2, which is a little worse. You see that they can get a little amnesia. Again, not losing consciousness. Finally, grade 3 is when someone loses consciousness. And I'm going to show you a little clip. Okay, this is actually something that you can all go online. I'm just going to go online here now. And I'm going to show you this clip. It gives a really great illustrated overview of what a concussion is. So let's just watch.
A concussion is a type of mild traumatic brain injury that can happen when your head receives a hard blow. Your brain is the most fragile organ in the body, with the same texture and consistency as gelatin. Your skull provides a hard protective shell around your brain. A watery substance called cerebrospinal fluid surrounds your brain. Cerebrospinal fluid cushions your brain against impacts with the wall of your skull during everyday head movements. This cushioning effect protects the billions of nerve cells, called neurons, inside your brain. Each neuron communicates with other neurons through electrical signals that travel down a long thread-like extension called an axon. A hard blow to your head can cause your brain to strike the inside of your skull. During the impact, your brain squeezes against the inside of your skull, sending shock waves through your brain. These shock waves tear or stretch the axons of some neurons. This trauma is called diffuse axonal injury or axonal shearing. The damaged axons normal brain function by interrupting communication between the neurons. Depending on where your brain is injured, physical symptoms of concussion may include headache, nausea, dizziness, poor muscle coordination, light sensitivity, blurred vision, ringing in the ears, slurred speech, and loss of consciousness. You may have mental and emotional symptoms, including disorientation, confusion, memory loss, inability to focus and concentrate, irritability, and depression. For a mild concussion, your doctor will advise you to rest and monitor your symptoms to make sure they don't get worse. You may receive prescriptions for mild pain medication such as acetaminophen or ibuprofen. Only take drugs recommended by your doctor, as others, such as alcohol, may slow the healing of your brain. Whether or not you've been to the doctor, if you experience loss of consciousness, a headache that won't go away, vomiting, or slurred speech, you should seek emergency medical attention. These symptoms are danger signs for serious complications of concussion.
So I think that gave you a really great overview of what concussions and how they actually physiologically start. Now, what I'd like to do is show you some of the rest of my slides here. Here we go. So what are the common misperceptions of concussion? Well, one of them is, hey, I didn't lose consciousness, right? I'm okay. Or it's just a thing, coach. I'm fine. No problem. Just saw some stars, right? They didn't get hit in the head, so you think can't be a concussion. I didn't get hit in the head. Or I'll just rest a little bit. I'll go back in the game. I'll be fine. And one is also a big misperception is it only happens in football, and that's not true. I mean, you could be walking in your kitchen, slip on something, hit your head, and you got a concussion. And you didn't play any sports, all right? So it's not just in sports, and it's definitely not just in football. And concussions are not to be taken lightly. As you can see, and again, more and more has been brought in the news lately, here's a story of a young high school athlete who committed suicide after having had a concussion. Now, there might have been some other predisposing factors and other things that come up in this kid's life, but it can be that the concussion threw him over the edge, and that's what his family and I believe that some of the medical experts believed in this particular case, as well as other cases. We've heard of NFL stars having problems, such as with something called CTE, chronic traumatic encephalopathy. And you know about the new movie Concussion that's out and sheds light on that. Here's some statistics. It's estimated that a concussive injury happens once every 23 seconds. And about 1.6 to 3.8 million sports-related concussions per year. Now that's just sports. That's not anything else. It doesn't include any car accidents or anything like I mentioned, tripping and falling on a sidewalk or in a kitchen or something like that. And as you can see above me here, is that as a person gets older, their risk of concussions go higher, right? You can see by age, in the 10 to 19-year-old range, concussions go a lot higher. Well, it's because those kids are tending to do a lot more sports and activities that could be put their heads at greater risk for those concussions. Now, what are some of the signs and symptoms? Well, often people feel headachy, feel slowed down, difficulty concentrating, a little dizziness, fogginess, fatigue, right? Blurry vision or light sensitivity. Your memory's not doing that great sometimes afterwards. You could have balance problems. This all depends on where the hit or the concussive injury occurred. Now, diagnostically speaking, MRIs and CAT scans will not detect a concussion, right? If someone gets a fractured skull, which by the way is really where the helmets come in and help out a lot, is to keep from head fractures, skull fractures. Now, someone can get what's called a bleed in the brain or a hematoma, and imaging studies like this will pick it up. However, they won't pick up a concussive injury. You might have to do things like SPECT scans, or these are functional imaging, which are single photon positron emission tomography. It measures blood flow in the brain. PET scans can also show activity in the brain, and functional MRIs can show function or activity in the brain. And some people ask me and they say, well, I don't understand. You got an MRI, you said can't pick it up. So what's this functional MRI? Well, it's a good question. There is a difference between functional imaging and structural imaging. A regular MRI and a CAT scan will show you structure. Here's a great illustration. Here you got Homer. Okay? Now, look up here. Homer, that's the functioning of his brain, right? He thinks beer, sex, donuts. He's got a section of his brain that handles all those things. Now, however, if we put Homer in an MRI or CAT scan, that's what we'd see. See? Little brain, but it's thinking about all that. So this is structure, like a regular MRI. This is function, like a functional MRI. And that's the difference between structural and functional imaging. Now, what about neurocognitive testing? That's one way to test the brain and figure out how a person is doing cognitively. And it's really great to do different types of neurocognitive tests. There's more full battery of testing that can be done by neuropsychologists and psychiatrists. And then there's computerized forms of this test, or these tests, which are shorter, which can identify if a person is concussed. But it's really important, however, to get a baseline before season begins so you can see how their brain is performing. And if a concussion happens to occur, or a thought maybe it occurred, you can see how they do compared to their baseline in the neurocognitive test. There's a popular one that's being used by a lot of coaches and some of the physicians. It's called IMPACT. It's a type of computerized neurocognitive test. There's one that I use in my clinic. It's called the CNS Vital Signs. It has a better database, I believe, and a little bit more accurate on picking up on concussive injuries. And it has it's used by the military, pharmaceutical companies, and the like. And it generates a report, pretty much like you're seeing over here. And you can see it measures things like neurocognitive index, verbal memory, visual memory, processing speeds, reaction times, attention, and it'll measure where you are with normative populations. You know, you average, above average, low, very low. And you can see in this particular example on the far right corner of your screen, you can see that they have issues with attention and cognitive flexibility. Perhaps this person had a concussion. And they're pretty good at picking up changes in someone who has a mild concussion or a severe traumatic brain injury. And you could see the graphing here is showing that you have norms on the left bar of each of these fields, and then you have you see a post-concussive traumatic brain injury and severe traumatic brain injury, and how that affects memory, motor speed, reaction time, complex attention, cognitive flexibility, and the like. Now I want to talk about another type of imaging, EEG Neuro Imaging. So what's EEG? Well, that's an electroencephalogram. You ever heard of EKG, electrocardiogram? That's measuring the electrical activity of the heart. This is measuring the electrical activity of the brain. It's like listening in to the signals created by all the groups of neurons. It's the whispers of the brain. It's the brain whispering to itself. We're just putting a little electrode on the scalp and listening in. We're not injecting any electricity. We're just listening to the brain talking. That's an EEG. And now we're looking at different brain waves. Okay, I'll just briefly go over some of these brain waves. We've got delta, about 1 to 4 hertz. These are our deep sleep waves. Okay? When you're in the deepest part of your sleep, you're producing predominantly delta waves in the brain. When you're in your REM sleep, dreaming also deals with memory and such. That's your theta waves, 4 to 7 hertz. Alpha, you're very relaxed, you're steady, you're getting ready to perform perhaps, chilled out. That's alpha. Beta is taking action, and gamma is even a higher brainwave state. Here are some of the examples of those brain waves. You have your delta. As you can see, they're very slow. They move along slowly. And hertz, by the way, is every cycle. How many cycles per second are you going to see the wave? Is it a delta wave? So every 1 second has about 1 to 4, 1 to 3 hertz, 1 to 3 cycles? Or is it a theta wave where you're having 4 to 7? Or is it an alpha, 8 to 12? Beta? Okay, you kind of get the idea. And this is like, the waves are always getting mixed together. Okay, it's if you're looking at a mixing board. That's why I put that picture up there. Okay, it's not just one wave that's going on in the brain at a time, it's all of them. But your different states of consciousness are a balance between those different waves. So if you want to put the bass up a little bit, okay, makes you a little more tired, you tune the knob up on the bass, so you tune the delta up, or if you want to be a little more awake, you put the treble up, get the high instruments going. And that's how the brain works, depending on where we want to have the function and where we want concentration, where we don't want to have concentration. And the brain tunes is also depending on the time of day, etc., etc. And the EEG is like a diagram of the communication between all the different systems of the brain. When the frequency, okay, that's the frequency, the hertz, like I said, theta 4 to 7, alpha 8 to 12, beta 15 to 18, etc., etc. When those frequency and the amplitude, the height of the wave, when the amplitude and frequency are optimal, communication's going great in the brain. But if some kind of damage occurs, someone has a stroke, traumatic brain injury, right, like a concussion, both the frequency and amplitude are altered, and that affects the communication in the brain. So we can look at brainwave morphologies. What does that mean? We can look at the actual shapes of the waves, and we can see what that means with different patterns. There's also ways of what's called brain mapping, with quantitatively measuring a whole group of these waves, mathematically figuring out where dysfunction can occur, and comparing that to a normative database. There's something called S-Loretta. I'm going to talk a little bit more about this, and that gives us other types of imaging of the brain. So here's some great wave patterns that are seen with the all-digital real-time EEG, created, invented, and patented by my mentor and teacher, Margaret Ayers. Now, Margaret's passed away, and I'll never forget everything she's taught me. She was a truly remarkable woman, and was one of the leaders and founders of the field of neurobiofeedback. So let's just look at what an image would look of an EEG brainwaves on her device that she created. or EEG. Here we have what's called a normal brainwave pattern. All right, squiggly lines, right? I don't need to teach you everything about it. And those are all these different brainwaves in here. Now look at this pattern. That's if someone had a head injury. See how it's really spiky up there, kind of in the center of that image? That is an indicator of a closed head injury. Now you could see over here, someone who had a coma or stroke and may have a noxic injury. See how different those waves look? So that's what's called looking at the brain wave forms, or the brainwave morphology. It can give us information, insights into what might be going on in the brain. Now, people say, well, how does that match up to other types of brain imaging? Well, I'm going to show you an example of a case that I saw in my clinic. Here's a 16-year-old male that came to see me, and he was hit in the left side of his face and forehead when he was 9 years old. I believe it was a skiing accident. His CAT scan, remember, structural imaging, didn't show any injury. But 2 months after he had his head injury, he started having seizures. By about 5 months later, he was up to a seizure every 1.5 hours. They put him on anti-epileptic drugs to stop the seizures. Over the years, he eventually weaned off of those medications. But 2 years after that, really bad headaches started with him. They were so severe, he was having a headache that was lasting 1 to 2 weeks at a time. And he would have this like twice a month. So the poor kid basically didn't have a life. He would just stay with these horrible, horrible headaches. Now, on the image here is a brain SPECT scan that I had ran on him. Now, this is a brain blood flow analysis. And the higher intensities, or there's more blood flow, and the lower amounts, the lighter colors, like the reds and blues, are low or no blood flow. And there's a natural no blood flow in it's called the ventricles of the brain. But there's areas of overactivity, areas of underactivity. Now what I'm doing here is I'm showing you how the brain waves looked overimposing these images on different areas of the brain. You can see those brain waves look different. Very different. And do correlate with his other imaging, because it takes energy, it takes oxygen to produce faster brain waves. Okay? So I'm not going to go into all these details. Suffice to say is that there are correlations with other imaging. Now, we can also do something called a brain map, and that's taking the EEG and doing a quantitative analysis. Okay, this is mathematical stuff, and we're comparing it though to a normative database. Clinically, it does, and we relate that to areas of function and dysfunction. Patient fills out an online questionnaire. We compare that to the QEEG findings, and you get something that looks like this. Here you can see these are the areas where the electrodes were on the scalp. Okay, what we're looking at is the amplitude of the waves on that top column, and we're looking at the speed of the waves on the middle column. And the lower column is talking about the communication between the different areas of the brain, between the right and left hemispheres. And they're color coded. What does that mean? It means within plus or minus 1 standard deviations of norm, you're going to show up with a green. If you're above that, it's going to show up as a red, and if you're even higher than that, 3 or more standard deviations, I believe on this map, is we're seeing yellow. So we can see in this particular case, the person has a lot of red and yellow, and they're delta waves. And in the front part of the brain, their delta waves are not only high, but they're actually a bit slow. So that's an idea of a brain map. Here we see a dashboard that compares where the areas that the person in their CEC says, I have a problem with attention. And But the areas of the brain relating to that, according to functional MRI studies and specifically what shows up on their brain, this is not showing so much perhaps with attention. Perhaps they have other problems like filtering difficulties that are showing up on their EEG. Here's another way of brain mapping. I'm showing areas of high intensity frequencies, areas of low intensity frequencies. Now let's take a little bit about S Loretta. It stands for a standardized low resolution electromagnetic tomography. That's a lot to say, right? Basically, is we're able to figure out where those frequencies on the scalp that we're picking up on the scalp are coming in, and we're able to look at deeper brain structures. So here's a cool image of an S Loretta imaging of a brain. You can see areas of the green and the yellow. It's nice and colorful, and it's just basically seeing according to a standardized database, are you again above or below certain ranges in those certain frequencies, the power of those frequencies, and the specific little voxels. That's why the little voxels are a little square. And because of this, we can even look at deeper brain structures and where those the readings on the scalp, where they are emanating in deeper brain structures. So this is pretty powerful technology and doesn't require any kinds of injections or drugs or radiation. And they have been doing comparisons of what's called Loretta imaging and functional MRI. Remember the functional MRI I told you about before? Blood flow imaging. So there are correlations, and it's a very exciting area in science and for the public as well, as I'll explain in a little bit. Here you can cap somebody. All right, here someone's injecting a conductive paste gel. It's about 19 channels or 19 sites in the scalp. We could see the entire brain all at once with the EEG, all the squiggly lines there. Here you see a patient wearing the gel cap. It's no big deal. Again, no radiation and no delay. We're seeing the brain right then and there. Now, I'm going to talk just about getting a baseline. All right, we talked about doing a neurocognitive test baseline, like the CNS vital signs or impact test. But what about looking and getting your brain waves, actually seeing your neurophysiologic brain as it is before, let's say, any injury? Or maybe you're looking to see if there was injury. Now, what can happen is that if we have not just comparing your brain to a normative database, but you do your baseline, you have your brain waves, you know what it was like, and then let's say you're in a game and you get hit. You possibly have a concussion, you don't know. Well, we could put you back on the EEG, compare you to where you were before. That's pretty powerful, right? You're saying, oh, am I worse or am I better than I was before? And now we can figure out not just when symptoms resolve, but when does your brain actually come back to where it was? Okay, it's another way. It's a really good indicator of saying, well, you can have a return to play. And then we can do things to even help the brain perform better, to get it back to where it was. Well, like I said, even perform better perhaps than it was. That's called neurofeedback. Talk about that in just a moment. So, what do we do to treat concussions, right? So here's a standard approach. You just say, okay, we're going to evaluate you on the field, which is always important, very important for coaches and trainers to know what to look for. Go to always, if you need to, go to a clinic or emergency department. When in doubt, make sure you go to the emergency walk-in or emergency department, right? Do imaging if appropriate. Monitor the person for 24 to 48 hours. Look if there's any sign of deterioration. It won't always show up right away. Got to rest, okay? Cognitive rest, that means, no on the phone, no iPads, etc., etc. And perhaps out of strong lights, no TV, that's rest. But if the symptoms are really persisting more than 10 to 14 days, you got to go see a specialist because something is going wrong. And then they have what's called the 5 steps to return to play. They can go back and do their sport. Now, what about post-concussive syndrome? Post-concussive syndrome is when these symptoms have been lasting a lot longer than, say, 10 to 14 days. It can be weeks, it could be months, or it could be years. And that seems to be statistically, they find about 5 to 8% of the patients, especially when they had multiple concussions, may have post-concussive syndrome. And then what do they tell you to do? Tell you to keep resting, keep monitoring them. But then let's say a person isn't able to perform at school properly. Their concentration's off, their memory's off, they may be depressed. Now they can't academically perform perhaps or do their job like they did before. So in schools, they'll put kids on a 504 plan. But aren't there other options? Aren't there other things we can do to help heal the brain? Well, here's one. It's called hyperbaric oxygen therapy. And there I am, standing right by our hyperbaric oxygen chamber. So I'm going to talk to you a little bit about this because it's quite exciting. So what is HBOT, or hyperbaric oxygen therapy? Well, hyper means excess. Baric means pressure. So what does that mean? Well, it's oxygen under pressure. Pretty simple, right? And conventionally, it's used for decompression illnesses, the bends, air gas embolism, carbon monoxide inhalation, a lot with wound care, okay? You can read the list here for yourself. This is what, if you go to some of the hospitals, they have hyperbaric chambers, and this is what they'll use it for. Now, there are other cutting-edge uses, or, for instance, I've been using it for things like cerebral palsy, multiple sclerosis, strokes, traumatic brain injuries, right? Concussions, traumatic brain injury, comas, Lyme disease, autism, Crohn's, chronic fatigue, mitochondrial dysfunctions, reflex sympathetic dystrophy. Okay, there's a lot of things oxygen can be used for. Oxygen under pressure specifically. It's one of the most important molecules to our lives, right? 4 to 6 minutes without oxygen, you're dead. So how does it work? Well, our blood cells are completely saturated under normal atmospheric conditions. That's called 1 ATA, 1 atmosphere absolute. The blood is about 0.4%, in the plasma. That's the liquid that carries the red blood cells. It's about 0.4% of oxygen at normal conditions. Now you put someone in a hyperbaric chamber at 2 atmospheres, that's about 33 feet underwater equivalent. They're breathing 100% oxygen. The chamber is pressurizing to make it like they're going down 33 feet. Now that volume's gone from 0.4 to 4.3% dissolved in the plasma. What does that mean practically? Well, they're getting more oxygen in one session than they would in the entire day. It's profound. And the more oxygen you dissolve in your tissues and your organs, especially your brain, your cerebral spinal fluid, that's the brain fluid, right? Dissolve it in cerebral spinal fluid, you're getting it to the brain. That's where it needs it the most, and that'll create healing. Now I want you to just watch this little clip and video, and you're going to see this is a brain image of somebody who has, this is called a SPECT scan, and you're going to see over here, right? Now look at that. It looks like the whole part of the brain just got shut out. They didn't lose their brain. It's just got the oxygen blood flow isn't going good. But there's areas that are still awake even after injury. They're just not functioning as well. We call it the penumbra, like the fallout zone. Now we take the oxygen, we increase it under pressure in a hyperbaric chamber, and voila, that brain can come back online. That's called awakening this idling neuron brain. And we see this with people with even long-term injuries. I had a patient, and hopefully I'm going to show you this video right now. And this is someone who had a brain injury. And I want to show you what hyperbaric oxygen can do. It's quite incredible. Isn't that incredible? That is showing you the power of hyperbaric oxygen with brain injury. Let me show you just a little bit about his brain SPECT scan. That's the imaging of the brain blood flow. Okay, this is before hyperbaric. Remember, the brighter areas or more blood flow, more activity in the brain, and the weaker areas like the greens here are lower activity. This is looking from the side of the head in. This is before, and this is after. Notice how it's much brighter, okay? And after. Here's looking again a different view from the top down. Before hyperbaric and after hyperbaric. Isn't that incredible? So what you saw with this patient is that all the spasticity that they had in their body, a lot of dysfunction, was finally able to relax up and they gained better motor control. And that's from hyperbaric oxygen therapy, awakening the brain that was just waiting to be healed. Now, let's talk about hyperbaric oxygen with mild traumatic brain injuries like concussions. My friend and colleague, Dr. Paul Harsh, had a journal article in 2012 that came out, and he did a study where he took combat veterans who suffered from traumatic brain injuries, some of them mild, but actually some of them severe, post-concussive syndrome and PTSD. He treated them with hyperbaric oxygen therapy, and they had over an 80% improvement. That's pretty incredible. As you can see here, this is a imaging of a conglomerate of all these guys' SPECT scans over time. So you can see there, the red is increased activity from the first hyperbaric. Just after one hyperbaric, you can see there was still some increase in activity in improvement. After 40, you can see improvement all over the brain. So let's talk about a case of a concussion or mild traumatic brain injury in before and after hyperbaric. This is a patient of mine, 22-year-old male. He was hit by a friend of his. They were intoxicated and they just kept pounding on my patient's head. 4 days after he was attacked, he came in, he had confusion, headaches, he was exhausted, he was lethargic, he wasn't able to sleep, he had anxiety and depression. Sounds like some of those signs of concussion, right? Now, let's look at a video of what his brain looked like before the concussion. Now we're looking at his S. Loretta, right? This is his brain right after he got concussed, 4 days after he got concussed. You can see the front. See how it's red over there? And I put a little +3 STV. All right, that's standard deviations. So beyond his age and gender, you can see all those areas that are red are beyond 3 deviations from the norm. Now what we can do is we can say, well, how far? Is only 3 standard deviations? Well, no. It actually could be quite a bit more. And here, even from the back of the head, you can see you have areas in front and back. Okay, we're looking at the slowest brain wave, which is the delta, and that really shouldn't be that high in a waking brain. And he's up to at least 4.2 deviations above the normative in those delta waves. After 10 hyperbarics, this is what we see. Look at that. Here we're looking at 3 deviations. He's well below that now. He's looking all green. So I said, well, how is he doing? Is it 2 deviations? Is it 1? And then we just start looking down. So we're actually seeing a brain that's been healing. Remember, he was over 4 deviations beyond what anyone should be. Looking from front to back of the head. So I'm just rotating the head around here in this image. And you can still see a little bit there at the back. There's at least 2 deviations above norm on the back left side of his head, and a little bit there on the right frontal, right temporal. And 1.4. And that's kind of now getting closer to the range of. So brain avatar, this S. Loretta, it could be a really great imaging tool to see before, after, and how hyperbaric can be so helpful to heal the brain. Now let's talk a little bit about neurofeedback. What this is, neurofeedback is a subconscious training of the brain, or retraining of the brain. It's neural pathways. We're giving the brain a mirror, literally, so it could see itself. It could see the patterns, right? If we were to say, oh, my hair's out of place, you could keep telling a person, oh, your hair's out of place here, it's out of place here. But the way to really correct it, well, how do you do? Give them a mirror and let them comment for themselves, right? So think about this. It's like telling your coach is telling you how to do your golf swing. You got to do this, you got to do that. Well, if you gave them, a little bit of feedback, like a film or something, they can actually see what they're doing and make those corrections. This is all giving feedback to the body. Here we're giving feedback to the brain about what the best brainwave patterns are for it to keep to. We're giving positive reinforcements. We're rewarding by either sound or visually, usually both. And when the desired patterns come in, that's when they get the reward, and it puts them back into place. Right, and it becomes permanent. So here we see different training screens. We can watch and see how the brain's performing. The patient can do something like play a game with their brain, Pac-Man. Okay, when their brain does good, Pac-Man moves. When the brain's not doing what it's supposed to, Pac-Man doesn't move. We can see games like kids can play going on a skateboard. Okay, the skateboard will do different tricks as their brain performs better. And they're usually getting sound feedback as well. This is a great example. I'm going to play this for you now with this individual doing neurofeedback training on the brain while they're actually doing a game where they're flying. Okay? So let's watch this. This patient's concentrating as their brain performs well. They'll fly through the target zone or improve their flying ability. You may hear little dings there, the steel drums, that's coming on as their brain is doing better. They get more audible reward. And we're able to watch their brain light up as it's happening, so we know how the brain's performing. So that's pretty neat. Now, neurofeedback can be a really, really powerful tool, okay? This is not just, you want to do things with it to like increase your performance on the field or in school, let's say, have attention issues. Neurofeedback is incredible. It can really help with that. Neurofeedback can actually help bring people out of comas. Now, my mentor and teacher, Dr. Margaret Ayers, had brought back numerous people of comatose states just doing neurofeedback. Just giving that patient who is in a unconscious state, Margaret said it was like they couldn't connect their conscious mind to their body. So what she did is slowly but surely and very delicately coax the brain to come back to its conscious function, doing neurofeedback. So the patient is listening to tones, and she would use like a light that would get brighter or dimmer, and that would start teaching them to come to repattern their brain waves. And she brought many, many people out of comas, including Rodney Dangerfield. I'm sure you can go look it up more on the web and find out about it. But it's incredible, and I've actually worked with a coma patient and saw them coming out of a coma. It's quite incredible. Now, I want to show you another case, a case of mine, where it's someone who suffered from a traumatic brain injury, and we used hyperbaric oxygen therapy and neurofeedback to bring them back when the doctor said this guy is going to be in a permanent, persistent vegetative state. There's nothing more we can do for him. Well, that's not exactly true, as you'll see.
October 28th, 2007, my son was in a car accident. The doctor didn't give me no hope. They said if he passed 24 hours, it would be a miracle. I always had a positive attitude. I always said, no, he will. I know God is not going to take him yet. It's not his time. We brought him here, and we started therapy right away. And I think at the third hour in a chamber, I started seeing the improvement on my boy. He was more alert. He was making more movement. He was like paying attention to everything. But still, doctors didn't say nothing. They are like, it's not possible. I said, well, it is. So Dr. Breiner told me that he was going to give continuing hours in a hyperbaric. He said from 40 to 80. But if you see the change right now, well, it's working. I said, well, we keep bringing him. And he kept moving. He kept doing a lot of things that he wasn't doing before. The doctors that work with him in the operation, they still don't believe it. He's eating regular food and all that, and he's talking. He's not talking conversation. But he is like, we ask him questions, he knows, he recognizes people, he recognizes numbers. His birthday was in October 24th. He knew the day of his birthday. We asked him, do you know, well, the birthday was the 24th, the accident was the 28th. So the 28th, I asked him, Tito, you know what happened today? And he said, yes. I said, what happened? Accident. And then he says, I don't remember. This therapy wake his brain up completely, because he was recognizing people and he was doing things slowly. But after the therapy, he's more alert. You ask him questions and he talk to you, not with voice, but you can read what he's saying. I don't know how to express my thanks to Dr. Breiner and his staff, the way they treat my boy and the improvement that my son done. And I know one of these days he's gonna get up. He's gonna get up and I'm gonna bring it here. And I said, Dr. Breiner, he's my boy. Thank you very much for what you did with your wonderful therapy to my boy.
Hello, everyone.
And wave your hand. Show me how you move your hands. Excellent.
Like
Like
this.
that.
Yes, like that.
Just put the other one down so you can see only one.
That's right.
You want to let your finger go? There you
Yeah,
go.
that's it. Now you wave. Yeah.
Very good.
Hyperbaric.
And this is oxygen
Oxygen.
therapy.
Therapy.
So now Rita's got to try it.
Okay. He says oxygen.
Mm-hmm.
Therapy.
Right, oxygen therapy. Is that what you did?
Yeah.
Yeah.
It was nice to meet you all.
Thank you, Dr. Breiner.
Thank you, Dr. Breiner.
You're welcome, Tito.
Look at the camera, Tito.
Give us a big smile.
Tito, big smile. That's it. Yeah.
Now, that was an incredible case, and not everyone has dramatic improvements, but almost everyone improves. It just shows you the power that the body has to heal. You just got to give it the right stuff, okay? We can help heal the brain with something like hyperbaric oxygen, reawaken it. I mean, it's a genetic therapy, actually. We're turning on and off over 8,000 genes in just one single session. And that is causing inflammation and swelling to go down, new blood vessels to start forming, stem cells to start circulating to most probably grow new neurons. And now you use something like neurofeedback to tell the brain nerves, okay, now I want you to grow like this. I want you to start repatterning and bringing back function. And it was great to see Tito. He went from someone who was going to be they're going to be in a persistent vegetative state, wouldn't talk, wouldn't feed themselves, wouldn't do anything. And then they're able to come back. Really amazing. So let's talk a little bit about other interventions. To homeopathic medicine, okay? We'll use that to help, especially acutely. Very important. And I can go on and on. These are whole lectures, whole series of information by themselves. But these are other things I'll use to help people who have concussive injuries or traumatic brain injuries. Nutritional products, nutraceuticals, okay? Antioxidants are very important. Botanical medicine, herbs, incredible healing power of herbs that God put into plants that we utilize. It's called botanical medicine. What about detoxification? All right, this is a really important point. You could see Senef and colleagues published in Surgical Neurology in 2014 a study saying, you know what? People have such toxic exposure around today from things like pesticides. They're affecting the brain cells, microglia, and the blood-brain barrier, that people actually, their brains are weak and primed or even inflamed before they even get an inflammatory injury like a concussion. And so they're saying, this may be one of the reasons we're seeing so many more concussions, is because the brains they're diminished. They're not as resilient because of all the toxins. So we want to look at preventatively detoxing the body, and especially if someone had a brain injury. Bioidentical hormones. Quite often when someone has a brain injury, it affects their hormonal system, okay? You will find that guys' testosterone goes down and thyroid can be affected. So sometimes it's necessary for, sometimes temporarily and sometimes more than just that, to have people get bioidentical hormones to help their brain heal. Do you know testosterone actually can help the brain heal? Chiropractic. Yep. And craniosacral therapy. Slide dropped off there, but chiropractic, when you get knocked around in a game or you got your head hit, we're all attached to the spine, right? The knee bone's connected to the hip bone, right? All that stuff, right? So imagine when you get this hit or accident or whatever happened, car accident, right? The spine becomes slightly malaligned and you get perhaps the nerves aren't getting as much blood flow and nutrients to them. It's called a subluxation, the chiropractors call it. The osteopaths call it osteopathic lesion. These need to be corrected. So I definitely encourage people to go see a chiropractor if they've had any kind of concussive injury. There's another thing called craniosacral adjustments, which are very gently adjusting the cranial bones, because yes, they do have movement. And when those are off, when the spine is off, when the cranial structure is off, cerebral spinal fluid flow, blood flow can be altered, and that will impinge nutrients, oxygen, getting to the brain. We're going through these again. Now what else? Phototherapy. This is a tremendous tool that we use in our clinic, and you can use light to actually induce healing. We use a laser light that will increase blood flow to the brain. That improves the mitochondria. Those are the parts of your cells, the little factories, if you will, of energy that produce ATP. That's the cash that we use to do everything, our cells use to do everything. It's called ATP. Mitochondria make the ATP. Guess what they need? Oxygen. Okay? Phototherapy at certain wavelengths of light will increase the blood flow to the area, will decrease inflammation, will get more ATP going, you'll get nerve growth. It's amazing. Altitude contrast therapy. That's when you exercise with oxygen. 100% oxygen. Getting the blood flow moving. And then we drop the oxygen for a brief period of time. So you went from 100% oxygen to about 15%. That's like going and working out in Aspen. Ever been high in the mountains, you're not used to it? You're sucking wind, right? Well, what happens though is that you get more relative carbon dioxide in your blood relative to oxygen, and you get what's called vasodilation. Your blood cells want to open up to get more oxygen to where it's needed. We take that advantage and then we flood you back again with 100% oxygen. And this helps bring out, reduces inflammation on those constricted blood vessels, and waste products are cleared out, inflammation and healing occurs. Now we've even taken one step further. We will do this before someone goes in a hyperbaric chamber. So they go from high to low oxygen, from high to low oxygen, and then they go to super high oxygen concentration in a hyperbaric chamber. It's an incredible 1-2 punch to really bring on healing. Pulse electromagnetic fields. Oh, that's saying thank you too soon. Pulse electromagnetic fields are using magnetics, pulsing a magnet. Okay, our cells are just electrical. They're all energy. And what we're doing is we're changing the magnetic fields on and off, and that's letting the cells re-energize, and again, helping with blood flow, helping with energy, helping with healing. So that is a really well, it took us, what, about an hour? And we only scratched the surface. But this hopefully gave you a lot of information about concussions, what to look for, baselining. Again, it's very important to get some baseline so you know if something happens, well, how bad is it? And then when are you back? And really importantly is what can you do to help if you get a head injury? And there are things you can help. Resting, taking it easy is very important. It is. But as you can see, there are other things we can do. We can do things like hyperbaric oxygen. In fact, if you're not in a life-threatening situation, like and the ER clears you, get into the chamber right away if you're able to get to a hyperbaric chamber, because that'll immediately start decreasing the inflammation and swelling. We can do things like, again, like neurobiofeedback to help retrain the brain. Or even if you don't have concussion or anything like that, we can help improve your brain's function. We can bring peak performance. That's one of the reasons we call our center the NeuroEdge, gaining that neurological edge, peak or performance center, because we're aiming for peak performance. And maybe you're a little older, your memory's not as good as it could be. Well, you can tweak it up. So I hope that brings a lot of great information to you. If you have any questions, you're free to call our office, 203-371-8258. I look forward to seeing you. Have a great day.